she's here at the Riveter, and we're so excited that she invited us to come and do a Flights and Rights here. And so let me tell you a little bit about what Flights and Rights is all about, and a little bit about our work before I introduce our speaker for tonight. So we actually started the Flights and Rights series in January of 2017. There was nothing unusual happening at that time. And what happened was, as you probably all know, a lot of people got energized about democracy at that time because they began to wonder if our democracy was as stable as we had all hoped, right? And as people got really engaged in wanting to know more about the ACLU and our work, we started having this series, which originally was a partnership with KEXP, and that's actually usually where we meet when we're here in Seattle, but we've also since then started taking it to other parts of the state, much to the gratification of ACLU supporters all around the state of Washington, right? So what we've been doing in this space is treating our friends and supporters and curious onlookers to a delightful beverage of some sort, and then sharing with them some information about the work that we do, and also ways that you all can get involved and continue to promote democracy in your own way, right? So that's what we've been doing. And it's really especially nice being here at the Riveter for this conversation, because this is a space that was developed and created by women for people of all genders, and today we're going to be talking about an issue that matters a lot to women and people of all genders, which is our bodily autonomy and our rights to make decisions about our bodies and where that's under threat and where we're fighting it. So that's our topic this evening, and I'm very excited to be here to do it. So, Caitlin told you I'm the executive director. I've only been in that role really for 2 months. Thank you. And I'm really so excited and energized to be leading the ACLU of Washington at this time. What we stand for is the rights, the civil rights and civil liberties of everyone in this state, and of course nationwide, everyone in this country, regardless of their national origin, regardless of their gender, their religion, their gender identity, whatever it is, we all have rights, and those rights need to be upheld. And our Constitution is a marvelous document that sets forth those rights for people. We also know that when it was written, it wasn't meant to apply to all people. It didn't actually really apply to women. It certainly didn't apply to people of color or people who immigrated here. So a big piece of the work that the ACLU can do is to lift that up and to make sure that everyone actually is protected and can enjoy that full freedom of that was promised, that is a part of the democratic promise of being in the United States. So that's our work. I'm really happy that we can do that work together, whether you work for the ACLU or you support us or you just show up in any number of different ways. So a couple of just introductory things before we get into the meat of our program. I guess first, I'd like to acknowledge that we are gathered on the territory of the Coast Salish people. It is land that was taken from them, and quite frankly, we haven't ever realized our obligations to the Coast Salish people or to any of the indigenous people of this land. And so we have a long way to go in fighting for that restitution. That is a part of the ACLU work and a part of an obligation of all of us who walk on this land. I also want to acknowledge a couple of things that have happened recently that really deeply touch and concern us. In Sri Lanka, so many were killed in that terrorist attack, and then just this past weekend at the synagogue in San Diego, there was another act of hate. And these acts of hate that have been so emboldened in this time and under this administration are something that we have to pay attention to. And a piece of our work also at the ACLU is really uplifting the dignity of humans and the respect and the compassion and love. We don't have to agree with each other. We don't have to share the same faith, but we owe each other that respect and that compassion and that respect for life. And so that is a big piece of our work, and I have to thank you. I have to just acknowledge that we are in these troubled times. And also, because you all just clapped, I should tell you something, which is that you are more than welcome to express yourself as we go through this evening, right? So sometimes we will say things that make you feel excited and happy, and you should cheer. Sometimes we will call out things that are disgusting and gross, and you should feel free to boo. And so feel free to be engaged as you're here with us, because we need to keep our energy alive and aloft, right? Because one of the things that happens when we're in a time where a lot of difficult things keep happening is that fatigue sets in. And we are not allowing ourselves any fatigue at the ACLU. We are fighting on a gazillion fronts, at the legislature, in the courts, at the ballot box, right? And so we invite you and ask you to keep your energy alive with us. Okay. Just a couple more introductory things. That's why I have my notes. I don't want to make sure I forget anything that's important. Okay. So, there's more. Okay. We have, one of the things that is going to get talked about tonight is how just last week in an ACLU case argued in Yakima, over there on the eastern side of the state, a federal judge blocked the Trump administration's latest attack on reproductive rights. And the speaker is going to tell you more about that, and it really is an exciting and important victory. And also, I just want to tell you, just this week, we had another really amazing thing happen. So through the work of the ACLU at Washington, in a matter of the first time in this country, we had a class action litigation that resulted in a jail changing its policy to provide medically assisted treatment to all individuals with opioid use disorder and a medical need for it. So yes, some of you heard what that means. We're going to say more about it. So opioid use disorder is a medical condition, and it requires treatment. And one of the things that have been happening in this state and in many local jails, as is happening in lots of places across the country, is that people who were receiving buprenorphine or any of the medical assisted treatments would get taken off of it when they went into jail. They were not being offered in the jails. And what we were able to argue is that that is tantamount to having someone who has diabetes coming into jail and saying, we're just not going to give you your insulin. Like, we just don't think that's important, or that's your fault or your problem. And so it's really powerful and exciting that we were able to achieve that victory this week through a settlement. And what's amazing about this settlement, which is something that wouldn't have happened in a court, is that not only will now the jail, and this was a case in Whatcom County, continue to offer medical treatment to folks who are already have that prescription. If someone comes into the jail and they have opioid use disorder that is not being treated, the jail will also provide that treatment for them anew. That's really a big deal. This is work that's going to save lives. And also, I just want to call out, because there are, maybe they don't really want you to know, but there are some ACLU staffers in the audience tonight, and they are attorneys, they're people who work in development and in communications, and all together it takes all of us in that space to get the work done. And I hope that they would just maybe do a wave. Some of our volunteers are here too. Just do a wave. Give them some love, please. Thank you, really appreciate that. So, I'm almost down to the wind up to get you to our main speaker, right? So we are live streaming on Facebook. So if you have friends who couldn't be here, you send them a text right now, tell them to log on to Facebook and they can watch if they want. And you, if you would like to engage in social media with the hashtag of ACLU Flights, whether that's Twitter, Facebook, Instagram, whatever you like to use, go ahead and do that. I want to give a huge resounding thank you to Sound Seltzer for providing the refreshing seltzers. And I'm going to taste it again. I'm going to in a minute. So the other thing I want you to know is we have a raffle. We always have a raffle at Flights and Right. So there's a raffle with some really cool gifts, both from ACLU and also from the Riveter. So please enter the raffle if you haven't already. And at the end of the discussion, must be present to win, we'll get a chance to give a couple of prizes. So now, I'm going to introduce our speaker. Our ACLU Healthcare and Liberty Counsel is Leah Redmond, and she's going to be speaking about reproductive freedom for women in today's political landscape. So before she joined the ACLU in 2013, she practiced commercial litigation at an international law firm and served as a foreign law clerk at the Supreme Court of Israel. She's also worked and volunteered at various human rights organizations, including Equality Now, ECPAT USA, and the United Nations. Leah is a graduate of McGill University and Columbia University School of Law, and outside of work, you can find her walking around the city or with her adorable children. She is an expert who has worked so hard to advance our work in this area, and she's going to give you the rundown of everything that's going on and things that we can expect and ways we can be involved. So please join me in welcoming Leah.
care to follow. But I am so excited to be here tonight, partially because this space is beautiful, and partially because this has been an incredibly crazy week. As some of you may know, the legislative session in Washington State just ended 2 days ago. So normally this talk would really focus on bills that passed, bills that didn't pass, things that advance reproductive health, ways we manage to combat the federal administration right now. And we will touch on some of that, but this, as I said, really crazy week. Not only did session end, but just this past Thursday, we had an incredible decision by a judge in Yakima federal court. The Trump administration had basically decided that they were going to try to ensure that millions of low-income people would not have access to family planning services. And a judge in Yakima said, no, not on my watch. So we are going to be talking a lot about that today. So that was pretty incredible. At the same time, any media outlet you read right now is talking about these other really discriminatory rules that the Trump administration is working on in the context of reproductive health care and transgender rights. They're supposed to come down any day now, and you can, again, expect litigation. So we need to talk about that too. So we have a lot to cover tonight. So I'm excited to be here and excited to talk about it, and excited to hear what kind of questions and thoughts you guys all have. To start us off, I'm gonna, back us up to a bad day, November 8th, 2016. It was a bad day for me, I don't know about you. I know, right? So people had a lot of concerns on that day about a lot of different issues. For me, some of that focus was obviously reproductive health care. In part because of the statements made by the president-elect, in part because who he's surrounding himself with, and in part because advocates like myself, the media, was talking a lot about this being the end of Roe versus Wade, this sort of being the end of reproductive rights as we know it. So I thought we could start tonight talking a little about, has that happened? To the extent it has, what does that look like? And to the extent it hasn't, why? And what we can continue to do in Washington State to protect reproductive health. So, I see the Trump administration really going after, chipping away at reproductive rights, sometimes shoveling away at reproductive rights, in three main ways. The first way, many of you probably have heard about, the Supreme Court. I do not have a lot of positive spin to put on this, sorry. As most of you I'm sure know, there is Roe versus Wade, there is Planned Parenthood versus Casey, there is Whole Woman's Health, decided in 2016. All these decisions ensure a right to abortion. That essentially means the government is not allowed to interfere. They are not allowed to put undue burdens, substantial obstacles in the way of people trying to access abortion care. This is what the Supreme Court has decided and decided and decided. We now have a very right-leaning Supreme Court when it comes to reproductive health. I'm with you. I am totally with you. So what does that mean? That means people like me are doing everything possible to make sure that the Supreme Court does not hear an abortion case, because we do not want to know where they come out on this. At the same time, you have people who don't support abortion doing everything they can to try to bring that case to the Supreme Court. In 2019, so we're just 4 months in, we are seeing around the same number of anti-abortion legislation that we would normally see across the country. The big difference is it is so much more intense. They are putting really crazy anti-abortion bills together for one purpose. They know they're going to get challenged by the law, and they're trying to bring it up to the Supreme Court. It's not a bad strategy, but it's not great for us. So what we're seeing are things like 6-week bans on abortion. That is blatantly unconstitutional. They know that's blatantly unconstitutional, but they want the lawsuit. They want it to be brought up. We're also seeing trigger bans. So what a trigger ban means, not in Washington State, let me be clear, but what a trigger ban means is that the day that Roe versus Wade gets reversed, if it ever gets reversed, then that state would outlaw abortion immediately. They wouldn't have to go back, let's not waste a day, to ensure that people don't have bodily autonomy. Let's make sure right now, today, that you cannot access an abortion. So that's becoming big too. None of that is good news. I can say in Washington State, yes, Supreme Court decisions, they apply throughout the country, but in Washington State, we separately already have protections in our state law that provides for access to abortion. We have a law, we have a law called the Reproductive Privacy Act, passed in 1991 by voter initiative, so people like you, that ensures a fundamental right to contraception and a fundamental right to abortion. Irrespective of what happens at the Supreme Court, that law stands, and Washington State should be secure. I will say it's all the more important that we work to both maintain those laws and expand them, because people in other states may need access one day, and we want to make sure we can provide that, not only to the people in Washington State, but people across the country. Yeah, okay, great. So, Supreme Court, not as much good to say, but I'm going to move on to things that get a little bit better. So another way that the Trump administration, in my opinion, has worked to chip away at reproductive rights is agency appointments. There are agencies in this country, such as the Department of Health and Human Services. Department of Health and Human Services, as you can tell by its name, what is helpful when you appoint people are people who believe in evidence-based comprehensive healthcare. Just one person's opinion. So, unfortunately, the Trump administration does not agree with me, and they have appointed people to this agency. One person who doubted the efficacy of birth control as a way to prevent pregnancy. One person who sees a connection between abortion and breast cancer. And to be clear, neither of those things are factually accurate. So when you appoint people like that, the problem is these agencies have a lot of power. Not only do they administer things like Title X, which is a family planning program, they also put forward rules and regulations. It's the federal government. They can't create laws. That's Congress's job. What they can do is they can sort of, in some ways, interpret it and someone tell you how to follow it. And that's what rules and regulations do. And the Department of Health and Human Services, and I may slip and call it HHS, has been very, very active in the Trump administration in doing that. So let's talk about that, because to me that's the third way that the Trump presidency has really focused on reproductive health. So soon after Trump was elected, there were rules that came out, and these rules focused first on birth control. As you will hear, and there's a consistent theme, there's a pattern of putting ideology before healthcare in a lot of these rules, and the result ends up being that it's the people who can least afford it and marginalized communities who are most impacted, because at the end of the day, money and power and privilege provides access. And so it's all the more problematic that these rules really end up impacting those who are least empowered. So the first rule was about birth control. And what it essentially said is, previously, the Obama administration had ensured through the Affordable Care Act that all health plans had to provide contraception free of charge. Hopefully some of you were positively impacted by that. And it was great, and there was a lot of litigation, but that was basically what it said. The Trump administration came along and said, look, we're gonna put forward rules, and what these rules say are, if you, employer or university, have any religious or moral objection, you can just say you have a religious or moral objection and not provide contraception in your plans. So essentially means an employer or a university would determine whether a woman had access to contraception, which is horrific. Yes, I'm with you, boo. And the ACLU definitely felt boo, as did many attorney generals, and this was immediately challenged. And by January 2019, courts had issued preliminary injunctions, which essentially blocks the action. It is not going forward until the case is decided, which is fantastic. But that was sort of Trump's first effort, which both the ACLU and the Attorney General in Washington State, who has been fantastic at challenging these things, both filed lawsuits. So, secondly, there was yet again a rule, and we're only talking about some of them. I don't have enough time to go through all the rules. But let's talk about another rule that the administration put forward. So in that first rule they were just like, hey, here's the final rule, which, by the way, you can't do. You first have to put forward an interim rule to allow public comment so people can give you their opinion, and then you can put forward a final rule. They learned from their first mistake, and the second time they put forward an interim rule. Now what did this rule do? Again, putting ideology before healthcare, what this interim rule did is it said, hey, if you are any type of healthcare entity, if you are any type of healthcare provider, feel free to use your religion to say no to people who are in need of care. Essentially, if you are a pregnant person suffering a miscarriage and you need immediate medical assistance, no healthcare entity or healthcare provider who doesn't want to provide it would need to provide it, which is horrible. If you are transgender and need services, entities and providers can discriminate against you. It is a really, really horrible, problematic rule, and the ACLU of Washington, as well as advocates around the country and healthcare providers, submitted comments very, very against this. According to media outlets and advocates, that rule is about to be finalized and should come out any day now, which is horrible. Yeah, absolutely. So people are gearing up for a response. I would predict lawsuits. I would predict ACLU lawsuits. I have not talked to the Attorney General, but I wouldn't be shocked if many Attorney Generals, including ours, want to get involved, because this is just blatant discrimination. It's discrimination against women. It's discrimination on the basis of gender identity, and it's just wrong. So unless the final rules look very different than the interim rules, which has not been happening with this administration, this is going to be highly problematic again. The positive news being that people are showing up and people are taking action, and courts have been very responsive because these things are blatantly unconstitutional, and courts over and over again have been calling out the government and saying, no, you can't do this, and blocking it. So I have high hopes that that would occur, but that is predicted to happen any day now, so watch your news. The third rule, which is the one I want to talk about, which was the huge victory for Washington State this past Thursday, has to do with Title X. How many of you, raise a hand, has heard about Title X? You are so well informed. Okay, I'm going to tell you more about Title X. So Title X, let's go back to the 1960s. 1960s, contraception, which is still expensive, was even more expensive, and there were huge inequities in accessing it, huge. And so President Nixon essentially called on Congress and said, we need to ensure that any woman who wants access to contraception can have it. There needs to be access to family planning services for anyone who needs it, which is a very worthy goal. So Congress created Title X. And what Title X does is it provides funds to low-income individuals who need access to family planning services. I believe in 2017, it provided access to 4 million people, over 4 million people, the majority being below or at the federal poverty line, and more than half being people of color. So this is an incredibly important program. It, yes, provides access to contraception, but it also provides breast cancer screening, cervical cancer screening, it provides STD treatment, it provides pregnancy counseling, it really provides the gamut. As with any federal program, abortion is not part of it. So providers have been able to refer for abortions, but they do not, if you're practicing under a Title X grant, through that grant you're not providing abortions. So then here comes the Trump administration. Again, ideology over healthcare. So what it decided is it was going to promulgate new rules again. And these rules were going to address Title X. The purpose, if you read the rules, are really to defund, as it's been trying to, Planned Parenthood and other clinics like Planned Parenthood, who are grantees of Title X because they provide a ton of family planning services to low-income individuals. So what the new rules would do essentially is a few things. What it would really do is it would say, number one, no provider can provide referrals for abortion. So not only can you not provide the abortion, you can't even provide a referral for an abortion. Now here what we're left with again is, so if you have money, you can go to a doctor and get a referral for an abortion. But if you're poor or at the poverty line, you can't, which is obviously inequitable and completely wrong. What it also did is it got rid of the non-directive mandate. What is the non-directive mandate? For the last 24 years, Congress has required that if you're acting under the Title X grant, you have to provide non-directive counseling, which means comprehensive pregnancy counseling. It includes all your options in pregnancy, including abortion. That does not mean they are suggesting you should get an abortion, but people who come should get comprehensive information. This rule would remove that. So what does that mean? It means that it allows room for Title X grantees to be people who do not provide comprehensive information. So people who are anti-abortion, people who don't necessarily practice evidence-based medication, they could now become technically Title X grantees, which is really problematic because it's replacing potentially high-qualified people who are providing evidence-based information with something else. And then potentially the largest problem. There has, and I want to make sure I get the full slew, so give me 1 second. I wrote this bit down. They require that Title X sites have complete physical and financial separation for abortion. So Planned Parenthood provides services to Title X grantees, and they also provide abortion, but they do that separately already. This would require such separation that not only, and this is the part I wanted to read because it's just crazy, not only would there be separate accounting and electronic and paper health records, you need separate treatment, separate consultation, separate examination, separate waiting rooms, separate office entrance and exits, workstation signs, phone numbers, email addresses, educational services, websites, and staff. So essentially what it's saying is, if it's read in that way, so what that could mean is that you can't be a Title X grantee if you provide abortion because there's no way to do that. There's no way to absolutely and completely separate everything to that degree. That is how they would defund Planned Parenthood and other clinics, and that's how they would ensure that millions of people, especially people in rural areas who often only have access to one healthcare provider in their area, would no longer have access to care. So millions of people could lose access to care. These rules were finalized in February. They are awful and inequitable, but of course, so the ACLU sued, and they have a plaintiff who actually has a representative in Washington State, Cedar Rivers Clinic. I don't know if you've ever heard of them, but they're an amazing organization. They provide both abortion care and advocacy. I've worked with them many times, they're incredible. I think we have some pamphlets for them as well up front for you guys to see. I encourage you to look into them, they're great. So they served as a plaintiff, as well as other entities, and the Attorney General in Washington State also sued. Essentially, yeah. As well as Attorney Generals, I think there are almost 24 across the country, other advocates. I mean, it's been pretty crazy. And we had heard earlier that an Oregon court judge had already made it clear that he was probably going to put some sort of injunction forward. However, it is really hard to get a preliminary injunction, which is totally legalese, so let me explain. A preliminary injunction essentially blocks something. It says you cannot act government, you cannot do it, because these final rules said on May 3rd we're defunding. So on May 3rd, individuals would no longer have access to care, and all these various entities that provided abortion and separately provided family planning would no longer get their Title X rules. That is crazy. And so what a preliminary injunction does is it says, you can't do that. You have to wait till this case is all figured out until you do that. But the only way you get that, the only way you can get there, is if you can show you have a high likelihood of success in the case, and if there's going to be irreparable harm. Someone is going to be really harmed because of this. And there are other standards we won't get into because I don't want to bore you. But the judge found not only that they met those standards, but that this injunction should be nationwide. That is even harder, yeah. So we are not just protecting Washington State here, we are protecting the entire country. And this just happened on Thursday. So that is for the AG and the ACLU's case. I'm sure similar decisions will hopefully occur throughout the country, but we have the preliminary injunction now. So the efforts will now be focused on actually winning the case. I think there is a high likelihood. It is pretty obviously unlawful in many, many ways, but it's really exciting. Not only that we are protecting people around the country, but it happened in Washington State is always, a nice benefit. So along with all of that that's going in, there's obviously a lot of positive and negatives to what I'm talking about. The negative is that there are so many efforts to reduce access to reproductive health care. The positive is that there are so many responses to that, and really strong responses, not just from the ACLU, who we're doing an awesome job, but like so many other advocates and government actors. And one of the really cool things that I found about the decision is the judge focused on the fact that there was so much evidence put forward, not just from us, not just from the AG, but other governmental actors in Washington state, other healthcare providers in Washington state, all submitted evidence to show that this would be detrimental to people. It was sort of everyone acting together to ensure that low-income people had access to the care they need. So that was really fantastic to see Washington state sort of coming together with this. That's all great. Washington state specifically also has been doing other things to increase access. And as I mentioned before, it is really important that we do that here and now because access might be so limited in other parts of the country. So what have we done? Well, this is where we can talk a little about legislative session. As I previously mentioned, we already have a great law in the books, the Reproductive Privacy Act from 1991. So we have the fundamental right to abortion and we have the fundamental right to contraception. But so many people still don't have access, right? So what does it mean to have a right if you don't have access to that right? And that's where we get into talking about equity and marginalized communities and all those really important issues that really determine whether something really is a right. Last year, during the legislative session last year, a new bill was passed in Washington state, which I think is great, the Reproductive Parity Act, also called the RPA, which makes acronyms really confusing for me, but still a great bill. And what that bill does is it ensures that if an insurance program covers maternity care, it also then has to cover abortion care. Yeah, pretty important and pretty great. The great side of that is that's ensuring access to care through funding, which is so important. The bad side of that is that took over 6 years to pass, and this is Washington state. So I can't even imagine how hard it is to pass bills and move things forward in some other states. It should not take us that long here to get something as simple as, hey, we should get insurance coverage for a basic, reproductive health care service. But nonetheless, it passed, and so it's now great. What happened this year in some ways was even more amazing. So one of the things I've noticed in Washington state and across the country, and hopefully many of you have seen the same thing, is the more Trump administration tries to exclude people, the more the reproductive health movement and other movements across the country try to include people. So instead of saying, well, you're going to exclude people, we'll focus on this group, the country seems to be saying, well, we want to protect everyone and we want to make sure everyone's included because we don't want to play into that narrative and we don't want to be part of this. And so that's really, really fantastic to see. And I think that is epitomized in one of the bills that the House and Senate have passed, has not yet been signed by the governor, but I am confident it will be, called the Reproductive Health Access for All Act. Yeah. So what that bill does, it was the work of a coalition called the Health, Equity, and Reproductive Rights Organization Coalition. And that bill does many things, including providing a health insurance program for immigrants who are not covered by other programs. So people like undocumented immigrants are not able to get family planning coverage through other state-funded programs. And so what this would do is it would create a program to do that. That part got taken out of the bill and put into a budget, but it should still have funding for that, which is fantastic. What the bill also did is it provided really necessary anti-discrimination provisions to protect on the basis of gender identity. So for transgender and non-binary individuals, to ensure that they have access to care that is non-discriminatory. Because what we're seeing in Washington state is even though we have great non-discrimination laws, a lot of people who are transgender would try to access reproductive health care services and just get automatically denied on the basis of their gender, which is blatant discrimination. And so having a provision in the law that makes that clear, I think, will really help ensure people who need care have access to it. Similarly, there were other reproductive health care services that were covered by the RAW, as we call it, the bill, that should help ensure that people have access to the care they need. And what I thought was really exciting about this bill is it does focus on communities that are sometimes ignored and are sometimes marginalized. So the fact that there is this effort to ensure access to care, and there still needs to be so much more, is, I think, in part a reaction to the Trump administration and something that's been really positive there. I will say that we still have a ways to go in Washington state. I can give examples of bills that didn't pass that really, I would say, should have. Comprehensive sex ed, that should just be basic. Sounds like many of you know about this, but sex ed should be a requirement in schools. Right now in Washington State, there is no requirement that schools provide sex ed. I know. There should be, and it should be available, and it should be clear that the curriculum applies to everyone, including LGBT individuals, and there should be part of it that ensures that language relating to consent is taught. And that's a bill that I just really think is essential if we want to ensure reproductive health care access and equality in general, and something that I encourage all of you to tell your lawmakers that you care about so that we can pass it next year. I think another bill that the ACLU worked really hard on that I really hoped would pass, and I think should have passed, was the Protecting Patient Care Act. That bill deals directly with some of the things, the rules we were talking with, are on the opposite end of, and it's ensuring that healthcare entities can't interfere with the patient-provider relationship. So if a doctor wants to tell you about information about reproductive healthcare services, or a nurse wants to give you a referral for an abortion, they can. And really importantly, if someone comes to the emergency room or comes to your clinic miscarrying, you as a doctor, as a provider, can treat them, and you can't be forced to make them leave just because of a health entity's rules. So that bill also didn't pass, which we think is really, really unfortunate, but we're going to continue to work towards those things in the next few years, and hope that all of you will do work and advocate with all of us to move forward. Another thing I think is so important in Washington State right now as we look at all this is just access. Access to contraception, access to abortion. I mentioned Cedar Rivers before because they were this amazing plaintiff and they ensure access to abortion, but I also just wanted to mention the Northwest Abortion Access Fund. I think we also have pamphlets for them up there. Yeah, they're an amazing organization as well. And again, they're an organization that we're doing a lot of advocacy, but they are on the ground ensuring they have a hotline to ensure that patients can find the providers they need. They will get paid providers to the locations they need to be, and they will help fund services for abortion. And so they're just such an amazing organization. There's so many other great organizations working around our states and individuals, making sure people have access to the care they need. So that was my little spiel. There is so much more we could touch upon, but we do not have all night. And so I welcome any questions or thoughts people have.